Hello there. Brainger Ron here, your personal tour guide as we head down that path of life called Trigeminal Neuralgia. I'm walking around the block right now with Fred. Hi, Fred. And I want to spend today talking with you about calcitonin gene-related peptide inhibitors. Say that 10 times. And because this is such a heady video, get it? Heady? We really need to work on your sense of humor. Need to work on my sense of humor. But yeah, because there is a lot to cover here, I just want to try to take out some very, very quick, easy questions that I know that is some of the very first questions I get when talking about this in the trigeminal neuralgia social media platforms. First question, does it help you? Yes, it does. Helps me out a lot. I take these inhibitors along with the other cocktail of medications that I take, including supplements, Botox, a whole bunch of other stuff. But do the inhibitors help me? Yes, they do. They work great in conjunction with what I'm already taking. And it's given me a little bit of quality of life back that I've missed for so very, very long. Second question, what are these things? Well, I'm going to cover a lot of that in the video later on, but I have included a link in the description box, and that link will take you to a rundown of all the medications, all the inhibitors, how they're taken, dosage, side effects, stuff like that. Have a glass of water nearby. This report is very, very dry. It'll suck the moisture right out of you, but go to the video description. Because we also have a lot to cover in this video, I'm going to do my best to put some timestamps in the description below so that if there's a particular interest you have, you can use that timestamp, sort of fast forward straight to the subject matter you want to hear about. Last but not least, is it costly? Yes, it is. Now, if you are in some financial difficulties or you do not have insurance, do not fret. A lot of these companies have a financial assistance program, so definitely, if you are interested in these CGRP inhibitors, definitely check out, see what kind of financial assistance that you can get. But yeah, it's very cold. I cannot feel my fingertips anymore. Fred and I are going to go inside. I'm going to turn on the fire, warm up, and then I'll talk to you inside. Okay? Cue the music. Okay, got the fire started. Fred's down here on his little bed. He gets the choice part of the fireplace because, well, he's Fred. So let's get into it. Calcitonin gene-related peptide inhibitors. I'm still amazed that I can say that. But just so you folks know, I'm going to try to do my best here as quickly as possible to kind of cover pretty much all the questions I ever get on these inhibitors from my perspective. Remember, I'm not a doctor. Seriously, who has two thumbs and is not a doctor? But I still hope that I'm able to provide you at least some information or some perspective from the TN side. Uh, I will say that, yes, my quality of life has improved significantly since I've been taking these. Having said that, uh, I do have a severely injured nerve. Uh, so there's a lot of things I can't do anymore that, well, since TN, but I still have the ability to do some things that I never even thought of that I was capable of doing. So I don't want to give any false impressions or false hopes or false information, but I just wanted to throw that out at you. And again, we have I've put a link down there talking about all these different medications, dosage, how they're administered, side effects, possible side effects, things like that. Now, before we actually talk about these inhibitors and trigeminal neuralgia, I have to give you a little bit of information about the actual peptide itself. Okay. The calcitonin gene related peptides is a naturally occurring thing. I have them, you have them, even Fred has them. And these peptides are busy little suckers. They do a lot in your body. They are an anti inflammatory, they help regulate blood pressure, they help promote bone growth and bone regrowth. So, yeah, there's a lot of positive things to say about these peptides. So, does people why do we want to try to inhibit them from doing what they need to do? Well, we only want them to inhibit what they do from about here up. Researchers found out that for those that have severe to chronic migraines, which some of us do in the TN community, uh, but if you don't worry. Okay, these medications still kind of follow through on the same thing, whether you have a migraine or not a migraine. But anyways, researchers found that for those that have severe to chronic migraines or just migraines, what happens is these peptides are produced in an abundance up here in your noggin. And being an anti-inflammatory, you'd think, well, that's good, right? Not exactly. As these peptides increase in number up here in your brain, what they do is they actually interact, they attach to receptors in the trigeminal nerve, which actually makes the pain worse. So you have a migraine, peptides come in, they want to hook up with the trigeminal nerve, they hook up, and then things get worse. It is a date from hell. Okay. Uh, Problem is once the migraine gets worse because the peptides are playing around with the nerve, more peptides are created, and they too want to play with the nerve. So, excuse me, it's a very vicious cycle. And researchers and pharmaceutical companies worked on how to break that cycle to either disconnect or stop from the connection ever happening. And in many cases, there has been great successes for those with migraines by taking these medications, whether it is a reduction on number of migraines that one has, or instantaneous or very quick recovery from it, or just, hey, I don't have migraines at all anymore as long as I take this med. So, okay, folks, I froze myself here for a minute because I really started to ramble more worse than I usually do. Here's the overall gist of what I'm trying to say. Whether or not you have migraines or not migraines, because this medication has proven very effective for those with migraines, there is a possibility it can assist with the pain reduction for those of us with trigeminal neuralgia. So, even though I talk a lot about migraines here, please keep in mind that I'm also trying to uh, uh, keep the impetus that we are talking about trigeminal neuralgia pain as well. But yeah, I'm blathering, 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 blathering. Look at the face he's making. Jeez. Again, I don't want to give anybody false impressions or false hopes. especially false information. But these are some things that you might have to shop around and find the right medication that is for you, because all the different pharmaceutical companies have figured out different ways to break that connection. Some of these medications come in pill formats or nasal inhalers, which is nice. Take them on a daily basis, you're good to go. Just throw it in with your pill planner, or make it a mix in your cocktail. You're good to go. And I haven't been on those, so I really don't want to speak too deep into it. But for me personally, it does have an appealing feel for me that once you get that level up of medication in your system, it stays constant as long as you take those, take those types of inhibitors. When I was put on the inhibitors several months after my microvascular decompression, because as is the case for several of us, uh, after the surgery, things can start going downhill again. I would still do the surgery though, because it did correct a lot of issues that I had that I know that just general medication wouldn't. So, but anyways, pills, inhalers, daily. There is also another one that you can take at home, which is actually a self injection. It's a stick. It's about 6-8 inches long. It has loaded into it the medication. You put it up to your shoulder, you turn a knob, and you're done. For those that are needle shy, folks, even before you get a chance to say ow, it's done. The medicine is in you. And the great thing about this is you only need to do this once a month. It's a 30-day injection. So the medicine that's in there is going to rush through your body for about 30 days. Now, I do say about. I was on them for a couple months, and because of my nerve is ground hamburger, and either it was the wrong medication for me, or the nerve was just, the nerve was just too bad off for the injections to work for me. Now, if any of these medications are prescribed to you, the ones that you can do at home, try them. What do you got to lose? I mean, you might find the one out of those three that will work. All right. But yeah, for me, those last few days leading up to my next injection, I was pretty much running on fumes, or where it was just out of my system. Expect that, for a couple of days, maybe you're going to feel a little uncomfortable. For me, though, it went from 3 days to a week and a half, and it just wasn't feasible. Uh, After my surgery, right around the time we were taking these things, I tried to go back to work, and that was a bad mistake, bad mistake. But because we ran through the gauntlet of those medications, there was one that had come out right around the same time as my decompression that my neurologist, fought to get the prescription for. The reason why I had to fight for it is this was a brand new prescription that was designed for severe migraines, not for trigeminal neuralgia patients. And again, we're used to that, right? I mean, every medication we take, not designed for TN. It was only out on the market for about 6 months, too. So, yeah, I can't say for certain, but either I was the very first or one of the very, very first to try this type of medication for TN pain. It is an infusion. It is an infusion that you do every 3 months, 90 days. So none of this daily or monthly, once a month, 3 months. You get that whole bag of brain juice right into you, right then and there. Um, it You might still, a couple days, or for me, a couple days a week before the next infusion, yeah, I'll feel it wear off. That's why I get Botox as a little bit of a bump before, about 2 weeks before my next infusion. Uh, the medication is called Vyepti. I am sticking to the name Vyepti because I cannot pronounce, nor do I ever want to attempt to pronounce what the pharmaceutical company calls it, and that is good luck with that one. But the whole process generally takes about an hour to go through. In fact, let me take you through it. So I go to the infusion center, which generally is going to be a cancer treatment center. All right, at least it is for me. It could be done in a doctor's office. I don't know, haven't had that, but for me, cancer treatment center. I check in, sit in the lobby for a few minutes, wear comfortable clothes. Okay, just wear comfortable clothes. You're not there for a fashion show. I wear uh, my comfortable shoes, uh, and I do that because I know it's on the other end during the infusion and after, and I'll explain that as we go along. After a few minutes, they send me back into where the treatment center is. If you have a history of cancer in your family or you yourself, you might remember the days where it was just like one big open room and everybody was kind of hooked up talking to each other. I can't say if those facilities still exist, but for at least mine, I have a nice little quiet alcove, readily accessible by all of the medical staff there, but you do have a little bit more privacy than what you had, years and years and years ago. I might be dating myself with age on that one. So moving on. When they put me back, uh, it's going to be a few minutes before they get all the stuff ready. So I do what everybody else should be doing. I play with the chair. Now that I'm done playing with the chair and getting chastised by the medical staff, they get an IV going in your system. For those that are needle shy, folks, just look away. I want you to look at the potential outcome of this rather than just that inconvenience of getting a needle in you. Uh, just look away. Takes only a minute. These folks do it on a daily basis. They're very good at what they do. So once they get the IV in it, and then they start flushing for a little while, kind of make certain everything's rolling through. That's when the medication, the Vyepti, comes out. Vyepti comes out in two different prescription sizes. For me, when I started, it was the 100 milligram. Again, one of the very first. A lot of people were watching about how it would affect me, kind of side effects, blah, 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 blah. So I started on the 100. And I was on the 100 for about almost 3 years. Um, Things started to take a turn, become more challenging for me. So they bumped me up to the 300. But yeah, either way, it takes only about maybe 20, 30 minutes max to have the infusion brought into you or administered. Don't be too surprised if you feel a little cool feeling. It's kind of like when you have a contrast done with an MRI. When they put it in, and you kind of feel cool in your chest and all that, or warm in your chest. The same thing. For me, it is in my head. I get a little bit of a pressure in my temples and behind my eyes. It's not necessarily a pain. It's just the brain juice is doing what the brain juice needs to do. It's brain juicing. Um, and excuse me. Shortly after that, takes a few minutes, feeling a little brain juicy. I get very, very tired. And that is not a normal reaction to this medication. And it concerned a lot of people until I explained to them why I get so tired. You folks will understand this. With TN, we do a lot of guarding with our bodies. We might kind of lean into the side that hurts so much. For some of us, we might scrunch the opposite side of our face that isn't affected by TN. Those without teeth in issues, I've seen them purse their lips really tight or clench their jaws. Uh, for me, it's shoulders. I walk around like this, and that puts a lot of tension in my shoulder muscles, my lower back, my neck. Once the Vyepti starts rolling through, I'm getting brain juiced. I start relaxing all that, and then I realize just how fatigued I am from just dealing with TN. It's, that's a given. Um, have somebody drive you. This is why. Okay, I have just had my infusion. Always makes me very, very tired. I'm going home now. Not driving. Yeah, Mrs. Brainger's taken care of. So, usually I'm kind of out of it for, a couple days. I just kind of lounge around, and, just let the stuff do what it needs to do. How quickly does it do any of these meds kick in? I can't speak for the pills or the nasal inhalers. For the shot, it took, I would say, about a day or so for me to start really feeling a difference, a reduction in pain. For the Vyepti, that one's a little bit more quicker. Uh, I'll tell you, I get so tired, I'm laying down. I usually go to sleep. So I know in certain emergency room situations for those with chronic migraines, there have been reports of somebody taking them and migraine gone. Well, BoBo's really jacked up my nerves, so it takes me a little bit longer. But it does last for a considerable amount of time for me. Again, 3 months. It's actually about 2.5 months, 2 3/4. That's when I have the Botox to get me the bump over. I'm not completely pain free from this. Okay, I'm not, but it does reduce the pain so that it is manageable, which to me, that's a godsend. I'm still not able to work, but I can at least do several things, that I used to do before work, before I had to give up work. I can walk Fred. I can walk Fred in cold, windy weather, in rainy weather, without a face covering. How about that? Still have my trigger. It still can kick in. I just keep aware of it, but I can still go do that. In fact, my trigger, this was my worst trigger. If you even just got close to it, flame brain. You guys know what I'm talking about. I can do this though. I have to do it gently, but hey, I can still do it. So yeah, in that regards, my quality of life has gotten better. Will I be able to get fully the life I had back before TN? No, that's not being defeatist. That's just me saying, all right, I have a new chapter of my life, and you know, with the pain management program I have, with my meds, with the Botox, with the Vyepti, it does help. I still have my moments though. So again, I'm not going to give you false impressions on this. I still, a couple times a week, I have to lay down because I feel some stuff coming on. But after laying down for 15, 20 minutes, I can sit back up and continue on. Uh, I just can't do a lot of things, bending over, lifting, long distance driving, things like that. Those still, we're working on that. Let's talk about possible side effects from any of these medications. Possible. I'm not saying these are going to happen to you. Uh, I really have very, very limited side effects. The fatigue thing, I consider that as an after effect. But again, with the link that I put in for all the meds, it does have side effects if you want to read it. Some of them, I kind of picked and choose just a few. Um, could maybe get a little dizzy, a little bit nauseous. Uh, you could have maybe some stuffy sinuses or a tight throat, a rash, hives. Again, this is all possible. Constipation. Oh, yeah. Yeah, be ready for that one, folks. That one came out of left field for me. But yeah, have some fiber nearby. That's the that's the best advice I can give you. Fiber. So, real briefly, that's what I wanted to cover for you guys today. Uh, if there are any questions that you have, please, please, please leave a comment. If there's something that I've missed, ask away down in the comment section. I have no problem making a part 2 to this for any of my videos. If you think this might help someone, please share, subscribe, thumbs up. I hope your days go by pain-free, or as pain-free as possible. Remember to laugh when you can, smile even more. Never forget that I love every single one of you, except you, BoBo. Screw you, BoBo. Screw you.